Welcome to this episode of the MoveMint Medicine podcast. Thank you to everyone that's tuned into the previous episodes. We really appreciate all your feedback and comments so far. Please continue to share with your friends, your family, and your colleagues. And like the Facebook page, share the content on the Facebook page, and also subscribe to the YouTube channel if you haven't done so already. We thank our partners for the podcast. So that's the Fit India movement, the Back to Fitness Clinic, which is the clinic that Rajat runs, La Ultra the High, which is the race that Rajat puts together in Ladakh, and also the Moving Mountains Within Film, which is the film about the 10th edition of La Ultra the High. So I'll pass over to Rajat, who will introduce today's guest.
Thank you, Darren, and thank you everyone for signing up yet again to MoveMint Medicine podcast. And today we have a special guest, Dr. Ramakrishnan. So welcome on board, Rama.
Thank you, Rajat. Thank you very much.
Rama, please tell us about your academic and professional background, please.
I am by training a surgical oncologist. For those who you are not familiar with medical terms, surgical oncologist is someone who operates on patients who suffer from cancer. I work at the moment at the Adyar Cancer Institute, which is one of the oldest specialized cancer treatment centers in India, and one of the largest as well. I did my basic medical training from Calicut, that is situated in the northern part of Kerala. After passing out of Calicut Medical College, I then enrolled for my Master of Surgery at Kilpauk Medical College, again in Chennai. Once I passed out of Kilpauk Medical College, I worked for some time at the Christian Medical College in Vellore, and then I joined the Cancer Institute Adyar for my super specialization degree that is called MCH in surgical oncology. I passed out in 2005, and ever since then I've been a faculty member in the Department of Surgical Oncology at the Cancer Institute. So that is in brief my medical journey and how I got there. To tell you a little bit about the hospital I work in, as I already told you, it's one of the oldest cancer centers in India. It is a not-for-profit charitable society that is at the moment headed by Dr. V. Shanta. You must have probably heard of Dr. V. Shanta. She is a legendary figure in the field of oncology. She's a Padma Vibhushan. So under her helm, the institute treats mostly the underprivileged, the people who are unable to afford the exorbitantly high costs of cancer treatment these days. Almost 30 to 35% of patients that we treat in our hospital are treated completely free of cost. Yet another 30% are treated under very heavily subsidized charges. So most of our work is with the underprivileged people. So cancer surgery is not very different from any other surgical specialty, but it is a niche area in surgery in the sense that cover everything from the head to foot. However, I specialize these days in abdominal cancers. I've always been fascinated by abdominal cancers, and so I'm focusing these days on abdominal cancers, especially colorectal cancers. So that's a brief background of me, who I am, and where I work. Yes,
That's
Roger?
absolutely fantastic.
Yeah.
Thank you very much for giving that introduction.
Thank you.
But I just wonder whether you could tell us about your fitness and exercise journey.
Okay. I started running sometime in 2013. Before that, in my childhood, I was quite active physically, in the sense I used to play quite a bit of sports. And unlike these days, when the children don't have enough space or the time to go out and play. As a youngster, I remember we had all the time in the world to go out and play, especially after coming back from school, even in school. There was a lot of open spaces back then. So playing and being physically active was never a problem then. I I used to play field hockey. I used to play cricket. I used to play a little bit of tennis and also a little bit of athletics. I have represented my school in the field hockey team and the cricket team and the Ernakulam district, that is in Kerala, where I studied. I represented Ernakulam district in field hockey at the junior level. Subsequent to my schooling, once I joined college, I tried to continue whatever physical activity was possible. Our college hockey team was looking for some players when I joined, and luckily there were very few people who actually knew how to play hockey, so I did not have much difficulty in getting into my college hockey team. I have represented the university also. I had the good fortune of being able to represent my university. Medical college is tough, as Rajat might know, but it is, we have fun too. So after college hours, in the evenings, all of us would get together and play either hockey or football or whatever we could, just to keep ourselves active and to break the monotony of studies. So we did have a good time as far as physical activity was concerned, even while in college. However, after I left Calicut Medical College, the pressures of having to settle down in life and establish a career took precedence, and the sporting activities fell back on the way. For almost close to 15 years, there's hardly any physical activity I could talk about in years, because I was more intent on my career ambitions. But maybe you could call it a stroke of luck. Our college organized a charity run, an 8-kilometer charity run in 2013. And all the faculty members were expected to participate. I generally don't like to make a fool of myself, so I wanted to prepare for the event. So I got a pair of running shoes. I didn't have any running shoes at that time because I never used to run. So I got a brand new pair of running shoes at discount, and just started training myself for that 8-kilometer run. I used to run around in the neighborhood every day for 2 or 3 kilometers, because that's the limit I could do at that time. But then I slowly got my groove back, and I realized that yes, I could do something more. And that 8-kilometer run, in fact, went off pretty well. And many of my colleagues were surprised that I was able to run so comfortably 8 kilometers. And so that struck a chord in me, and I thought, yes, maybe I should start becoming more physically active. So I thought running was probably a good option, because it doesn't involve much cost. You just need to don a pair of shoes and the road is yours. So that's how I got into running. And luckily for me, it was around that time that the running movement actually was starting to grow sort of in Chennai. Right now, there is a huge running culture in Chennai. And I was fortunate enough to be part of the time when it was actually starting. So I joined one of the largest running groups in Chennai. It's called the Chennai Runners. We have a lot of chapters within the city in different parts of the city. So I joined a chapter called the Busy Flyers. And that group motivated me to go further in my passion for running. And like in any other group, once you get into the group, then all the talk of running marathons gets into your head. So I I ran my first half marathon in Lyon in France 2014, and then my first full marathon in Bangalore in 2015. After that, I have ran a couple of full marathons, probably 6 or 7. And fortunately, I was able to qualify for the Boston Marathon this year, which was supposed to be held 4 days back, but unfortunately got postponed because of this pandemic. So I hope to run the world majors, all the 6 world majors at some point of time. That's where I am now.
So Rama, if I may, what's your time then for a full marathon?
The time I qualified for in Dubai was 3 hours 6 minutes. And
3 hours 6, not bad, not bad. Great. So what happens, has there been a change in the way you see your patients now or advice that you're giving since you picked up your running and fitness mojo again, almost, right?
Yeah.
So is there a difference, you being a doctor, and the way prescription is being given about physical activity or the importance of it? Has there been a change in it?
Yes. Before I started running, I wasn't bothered about my own physical fitness or health. And maybe as an extension of that, I wasn't concentrating on the physical aspects of disease and how physicality plays a role in the specialty that I am in, that is cancer. So once I realized what running brought into me, I have started trying to motivate not just my patients but also my colleagues at work to engage themselves in physical activity. But unfortunately, Rajat, many of the patients who come to our hospital either are not in a shape to undergo any physical activity, nor are they inclined to do so. Because of the kind of patients that I see there, most of them are daily wage laborers. But at the same time, because they are daily wage laborers, they seem to be physically fit. In fact, they appear much more physically fit than the urban white-collar job patients that I get to see sometimes. So, but it is difficult to explain to them the importance of physical activity, because some of them look even more physically fit than I do. But at least to the people who are able to understand the importance of physical activity and who can spare time for that, I do tend to give them a little bit of advice. Whether they follow that, I'm not sure, but I do try.
So Rama, you've obviously learnt the importance of physical activity through your personal journey.
Yeah.
And obviously now with a marathon time of 3 hours 6 minutes, that's pretty impressive. I just wonder why are doctors not taught about the importance of physical activity enough at medical college so that they can then actually communicate that effectively with patients?
Yeah, that beats me. That is a question that I have thought. The Indian medical curriculum lacks in so many measures. Part of which is the importance given to holistic care in disease and in wellness. So we are taught a little bit about the association between physical activity and disease, but it just lies there in the book, and we as students we don't realize the importance of what is written there unless we actually have an experience that we can correlate that with. I remember when I was studying for my super specialty degree, There was quite a lot of literature even then, almost a decade ago, about how physical activity relates to cancer. And even now, there is a lot of literature available on that. A lot of information, especially from the US and UK, on the effects of physical activity in cancer, cancer risks, and cancer outcomes. But somehow in India, that has not penetrated into the mindset of doctors. Maybe partly because as a nation, we are not so, at least till now, we were not so physically active. The fitness movement was not so much present in those times. But yes, to those of you who are listening, I would like to mention a few points about physical activity and if I may, with your permission, Darren. So the physical activity is, many of them ask, what is physical activity? I work in the kitchen, is that physical activity? I go out for a walk, is that physical activity? So, you know, any movement while you're awake, which makes you use your skeletal muscles, and for which you will have to spend more energy than what you would while you are resting. That is called physical activity. So the association between cancer and physical activity has been well studied, and it is now documented fact that the level of physical activity that you are engaged in has a direct bearing on the risk of your developing cancer. Many cancers, for example, colon cancer, esophagus cancer, that's a food pipe, then the stomach cancer, breast cancer, cancer of the bladder. All these cancers have been shown to have a reduced risk in those people who engage in at least a moderate level of physical activity. So, but keep in mind that these are associations, and we cannot definitely say that there is a definite causative effect of lack of physical activity with cancers. But you know, if you see a lot of these associations multiple times repeatedly, you would tend to believe that there is some causation also. And the science behind the association of physical activity with cancer is still being studied. So we really don't know what is it that causes a reduced risk of cancer in people who do physical activity. But there are some theories that have been postulated. You know, physical activity reduces the level of your, especially in females, the level of sex hormones called estrogen, which is responsible for, in part, for breast cancer. It reduces the level of the hormone called insulin, which I'm sure most of you would have heard. These are all, for some cancers, these are growth promoting hormones. At the same time, physical activity also keeps your obesity in check. Obesity, in fact, is a risk factor for some type of cancer. So physical activity indirectly by reducing the obesity factors can also play a role in reducing the incidence of cancer. So there is a lot of ways by which physical activity helps in reducing cancer. So naturally the question that is asked is how much physical activity do you need to do in a day if you want to reduce your risk? There is no clear answer to that, but however, the United States National Institute of Health have come out with some guidelines on how much physical activity you should do, and they recommend that every week you spend at least 100 to 300 minutes doing a moderate level of aerobic activity, or you know, an hour or so of intense physical activity, along with some sessions of strength training, and that is supposed to help reduce your risk of cancer. So that is the association between physical activity and cancer, which is a field that I work on.
Thanks, Rama. That's actually very cool. And could you just address 3 to 4 myths as well, besides this whole, correlation between exercise and cancer, but other things that people are not necessarily aware of or have totally wrong thoughts about? And it can be cancer or other, with cancer or physical activity, or together. It can be just cancer as well.
So, yeah, see, probably the most common myth as far as cancer goes in India is that, cancer is a death sentence. Wrong. I would like to say that cancer is not a sentence, it is only a word. So there is nothing to be afraid of cancer, what you should be afraid of is not the diagnosis of cancer, but the delay in diagnosis of cancer. So, so this is here is where the importance of the warning signs of cancer comes. So I think everybody must be aware of some of the warning signs of cancer, which could prompt an early diagnosis. Like a lump that you discover suddenly one day, maybe in the breast, maybe in the arm, maybe in the leg, or an ulcer that does not heal, or unusual bleeding, bleeding from your gums to the mouth, or bleeding while passing stools, or bleeding in the urine, any recent change in your bowel or bladder habits, if you have a nagging cough, if you have difficulty in swallowing or difficulty in eating. These are all warning signs. These are all the red alerts that should make you think, yes, I need to get myself checked, and prompt you to go and visit your family doctor. So that is a common myth, that cancer is a deadly disease. But at the same time, with the advancements in medical technology, these days we are seeing quite a large number of patients who get cured. If you put all the cancers together world over, nearly 60 to 70% of patients with cancer are getting cured. And in some cancers, like cancer of the thyroid or cancer of the prostate, it may go up even as high as 90%. So you really don't need to be worried if you have a diagnosis of cancer. The other common myth that I often find is that the patients believe that cancer is a contagious disease. Cancer is not a contagious disease. It is not an infection. It does not spread to your loved one if you touch them or if you stay with them. So cancer is not a contagious disease. And also cancer is not usually a hereditary disease. So many people believe that if I have cancer, then my child get cancer. Less than 5% of most cancers are transmitted from the parent to the offspring. So there is no need to worry in that regard too. And then there are so many treatment-related myths. The fear of chemotherapy. Will I lose my hair? Will my hair grow back? Most chemotherapy regimes do not cause you to lose hair, and even if you do, they do grow back. So, and chemotherapy is not a very painful treatment. Of course, there may be some side effects, but it is not a painful treatment, and most of the side effects can be managed. Yet another myth is that if you operate on a patient with cancer, that will cause the disease to spread, which is again wrong. There are quite a lot of misconceptions and myths surrounding cancer. And through your podcast, I hope whoever is listening to it will propagate the fact that cancer is not a deadly disease, and all the myths. I hope I've been able to debunk at least some of the myths that have been associated with cancer.
That's all extremely important information, Rama. Thank you very much.
You're welcome.
So I just wondered if you could just give some general recommendations as to basic steps towards physical activity for everyone in society, whether it's cancer patients or otherwise.
So I hope by now everybody would have realized the importance of physical activity. Being a cancer surgeon, I've probably been biased most of this talk towards cancer. But besides cancer, physical activity can help you at least prevent so many other diseases, diabetes, hypertension. I know we have in our running group, we have people who were diagnosed to have severe diabetes and hypertension, and they started running, and they have shown me the downward graph of their blood pressures, of their blood sugar levels. So there are so many other diseases also that can be taken care of by running. But the most important and the first step that you need to do is to find time. It's the most common excuse anybody can give is that, oh, I don't have time, which is wrong. I mean, if you want to find time, there are so many ways that you could find time. I get up at 4 o'clock in the morning to get ready for my run. People who are going early to office could get up early. People who go late to office can get up a little late and find time for the run. You could do some little bit of physical activity while you are at work. Most people who just have a desk job are prone to so many other occupational injuries. So they can keep themselves free from these injuries by practicing some small techniques, which I'm sure any movement specialist would teach them on how to prevent these kind of occupational injuries. So the first thing that you need to do is probably to find time to engage yourself in physical activity. And it doesn't need to be hours. You need to do at least 20 minutes of some sort of activity every day. It could be swimming, it could be walking, it could be just going for a jog, it could be doing an exercise at home. So that's the important thing, to find time. And then, of course, you must also realize that you should not get carried away by all the enthusiasm. You must embark on this under supervision if possible, especially if you're starting to run, or if you're starting to do exercises at the gym. It's always better that you do it under guidance, because you don't want to end up getting injured and then losing interest in whatever you're doing. So I would advise anybody who wants to get into physical activity to go slow. You're anyway not going to get into the Olympics, so this is just more for your health and not to destroy your health. So take it easy, go slow. You can always upgrade yourself depending on how confident you feel. And so especially for runners, at least from my experience, I can tell you that the importance of strength training, which I learned the hard way. Most runners, I don't think there is a runner who has not had any sort of injury. So I myself have had a couple of injuries which have made me lay off running for months together. So it was then that I realized the importance of strength training for runners. So find time to do some exercises. You can join a boot camp, you can join a gym, you can do it at home. So there are so many videos online now that you can refer to and help you in developing your muscle strength.
Thanks, Rama. That was wonderful. In summary, could you just again touch on the 7 signs of cancer as a, just so people are very clear, are more aware about it, please?
Yeah, sure. So, number one, if you have a sore or an ulcer that doesn't seem to be healing. Number two, if you have a lump which was not present earlier anywhere in your body, could be in your breast, could be in your hands, could be in your legs, anywhere, which seems to be getting bigger and bigger, and which seems to be painful, that is another warning sign. If you have a wart or a mole which has suddenly changed in color, or has become big, or is starting to pain, that could be a warning sign. Any unusual bleeding or discharge, it could be from your gums, it could be bleeding while you pass stools, could be blood present in your urine. These are all not usual things that you would expect to find, but if you do find any of these, then immediately I think you should consult your doctor. Again, if you have a nagging cough, if you have a hoarseness of voice, which is persistent for quite some time. If you find it difficult to swallow food or to eat food, if you think there's any recent change in your bladder or bowel habits. So these are 7 signs. Of course, there could be cancer could present in a myriad sort of ways, These are just the common signs of presentations of cancer. So 2 things you must keep in mind. Just because you have the sign doesn't necessarily mean you have cancer. It should prompt you to seek medical attention. And at the same time, you could also have cancer even if you don't have all these signs. So this has to be kept in mind. But for the layman, I think these are 7 important signs or symptoms that they should be aware of if they want to keep themselves healthy.
Brilliant. That's absolutely fantastic. Thank you very much, Rama. It's been a pleasure having you on the podcast.
It's been my pleasure too. Had a good time. And thank you once again, Rajat and Darren, for inviting me here to be part of your wonderful program.
Thank you, Rama. Thank you so much.
Thank you.
Thank you.
So we'll bring this podcast to a close, and we hope you join us next time. Thank you very much.